Hey everybody, and welcome to our show, Prescriptions for Healthy Food. I'm your host today, Hal Brock. With me, as always, behind the cameras, our IT director, Mr. Ed Harrison.
Hey everybody, how's it going today?
Hey Ed, we've got a great show lined up for everybody today. Our own General Surgeon, Dr. Virgina Harr, she's in the kitchen today, and we're gonna make a low-salt diet meal. It's a chicken with apples and onions and cranberries. Sounds absolutely delicious. Okay, so before we welcome out our General Surgeon, Dr. Virgina Harr, I just want to do a quick congratulations to the senior class of 2020 for graduating high school. I know a lot of different schools are celebrating in different ways this year, some holding virtual ceremonies, some ceremonies have been pushed back. So from all of us here at Southern Plains Medical Group, we wanted to recognize your accomplishment and give you a congratulations. All right, I want to welcome everybody to our show, Prescriptions for Healthy Food. I have got our wonderful General Surgeon, Dr. Virgina Harr. Thank you so much for coming out here and doing this.
All right, you're welcome.
Absolutely. And so, Dr. Harr, how long have you been with us at Southern Plains?
I started in 1984.
1984, okay.
So you can do the math.
Yes, absolutely, absolutely. Well, hey, just an incredible general surgeon, and I mean the service and the lives that you've saved and prolonged and, you know, counseled so many in this community. I mean, we as a people owe you a lot. So thank you so much for all you've done.
You're welcome.
Absolutely. So what are we cooking today?
We're trying out a new recipe.
Okay.
I've read it off of what's called the TSAT, which is the Tobacco Settlement.
Tobacco Settlement. I sit on the Grady County Board, so a very cool cause.
And so not only do they talk about stopping smoking, but they have healthy living tips.
Okay,
and this is a recipe off of that.
Okay.
Okay. And they graded difficulty as a level 2.
Okay, so 2 is on the good end or the 10?
It's on the good
on
end.
The easier end. Okay, that's good. Because you're cooking with me, you know, so you gotta.
Yeah, and it's really not hard.
Okay, good.
All right.
Good. Yeah, let's go ahead and get started. So it's a chicken dish, and we chose this one off of TSAT because it's a low salt meal, right? Okay, and what's the importance of low salt diet?
Well, low salt diets have been shown to decrease hypertension.
Okay.
And if you can decrease hypertension, you decrease heart attack, stroke, kidney failure. But you know, our main diseases in our state, heart attack, stroke. So anything we can do to control hypertension,
absolutely, we're in good shape. Absolutely. Now, hypertension, that's high blood pressure, right?
Correct.
And the chronic high blood pressure, I mean, something that you have kind of consistent. That's when, like if I have high blood pressure once or twice because, you know, my kid threw something out the window, that's something. But hypertension, I mean, that can get very serious to where it causes people to black out. It causes, what else can it lead to?
Well, it can lead to heart failure, which is where your heart dilates and it just won't pump the fluid around, which is the blood. High blood pressure leads to more hardening of the arteries, which is cardiovascular disease, which would again be heart attacks, strokes, and then kidney failure.
Well, perfect. Well, I'm glad we're getting this, and you know, this is something that we started. Actually, Dr. Malouf and you came up with the idea, and Dr. Malouf led us off with a spinach dish. So I'm super excited. We're going to continue doing this kind of sporadically. Of course, we had to pause there for a little bit because of the coronavirus epidemic, but I think it's important once we do start getting out and about that we do pick back up our healthy lifestyle. Just because we've been sheltered in place and maybe not eating the best stuff. I know me, it's been like Oreo cookies. Like it's been a detriment to my health. But hopefully we can get back out and start eating healthy.
Yeah.
Okay, cool.
That's good.
Well, let's start cooking. What can I do to help? I washed my hands, so that's the first step. Wash your hands.
Wash your hands
before you touch all this stuff.
20 seconds?
Yes.
Wash your hands for 20 seconds.
You can sing songs.
Yeah.
You know?
So the first thing we're going to do is season our chicken.
Okay.
And so we just, you know, like salt and pepper, kind of like we season everything.
For sure.
And so, you know, on the salt, they actually measure how much.
Okay.
And so if we would look at it this way, that's about 1/4 teaspoon.
Okay.
And that really and truly is all that this is going to need.
good.
And then one thing I learned from watching the chef's show
Yes.
is you sprinkle from high.
I love it. Have you seen the guy that can sprinkle it off his elbow like the big table salt? It's pretty cool.
So I always thought that was kind of a gimmick that chefs did.
Right.
And it actually helps to move the whatever you're sprinkling from high. It gets it more evenly.
Spreads it out a little bit.
Mm-hmm.
Okay.
Okay. Then our next step is we've been reheating this.
Yes.
It's really hot. So we want about a tablespoon of oil in there.
A tablespoon of oil. Okay, let's.
There you go.
I'll make a total mess, although it's going to be me cleaning it anyways.
Yeah. And remember, guys at home, you don't have to measure precisely.
Right.
But if you're watching your calories, you should definitely measure your oil.
Okay.
Because that's got the most calories in it.
Okay.
Okay, and then we just slap this in. So one thing that if you're at home you'll want is to have a plate where you can pull this out. And I've got one over here, Hal.
You have one? Okay,
Yeah.
perfect. Just in case we need some.
Yeah. And remember, because it's chicken, you don't want to cross-contaminate.
Right.
Yeah.
For sure. Especially right now.
Yeah.
It's not the best time to be mixing things around.
Yeah. So we're just doing this in a hot plate, but you can do this on a stovetop in a big frying pan. And one of the reasons I like this recipe was you don't have a lot of pans you have to.
Right.
So as far as the cooking part, you can use, like any kind of boneless chicken, so chicken thighs, chicken breasts. I think this recipe would do really well with pork.
With pork?
Mm-hmm. Although if they don't say anything about it, but I think if you had a boneless pork, that would be really good. And so we want both sides to look a little bit brown. Can you see that?
Yeah.
Okay.
For sure.
So because we're going to use some liquids at the end, we don't have to be super picky about how many minutes that we use this or cook this in. But if you have an electric skillet, we've got this set at 350, which is kind of medium to medium high.
Dr. Harr, what kind of got you into medicine?
It was kind of a weird thing.
Okay, really?
Yeah. My mother suggested it when I was 18.
Okay.
And of course, when you're 18, you say no.
Yeah, right. I'm done with school, right?
Yeah,
I just went through high school.
No, I knew I was going to go to school.
Okay, yeah,
but
right.
I was going to be a scientist.
Okay, cool.
Yeah,
cool.
so,
that was kind of your interest. Was
was
it biology, microbiology, or just what kind of science?
Didn't make any difference.
Really? Okay.
Yeah.
Cool.
So, I went to a big university in the Mizzou Tigers.
Oh yes,
in
yep.
Columbia.
Yep.
And all the kind of thinking a little bit, watching all my buddies and stuff, they were all doing pre-med stuff, and kind of looked at it and they said, oh, you ought to do this. And so I did.
Okay. All right.
So it wasn't like I was born with a burning desire to do medicine. My family didn't have a lot of money, and if you were going to go to school, you were going to go to school in town.
For sure.
So,
go to the state school and stuff like that.
Yeah. So, okay, these are lightly browned on both sides.
They look delicious, and they smell so good, Okay, cool. So now what can I help you with? So we've got the chicken out.
Need another tablespoon of oil.
Another tablespoon of oil. So we're going to do 3 of these bad boys.
Yep.
All right. Well, so how did we get so lucky to have you here in Oklahoma?
Well, I knew I wanted to do general surgery.
Okay.
And I knew I wanted general surgery in the kind of the Midwest area.
Right.
So I interviewed a lot of different places, and this was a really attractive place because we had Dr. Linda Johnson here.
Right, yeah,
And
no
we
kidding.
had Dr. Pilar Escobar.
Yes.
And we had Dr. Nancy Deaver.
Wow.
And
wow.
so you know,
yeah.
that was very unusual.
For sure.
In fact, one place that was much bigger than here asked me who my patients were going to be.
Yeah, really.
And I looked at the guy and I said, people who need surgery?
Yeah,
You know?
I mean, yeah.
So I didn't think that anybody would ever have any problem about a female surgeon until I
good.
went there. So
Until you went there, wow.
yeah, so
And that was kind of the light bulb kind of clicked on.
yeah,
and everything?
that I needed to go someplace that had some other females.
Just kind of welcoming and stuff like that.
Yeah.
And my goodness, yeah, Dr. Linda Johnson, one of the first female general surgeons in Oklahoma. That's nice person to have
Right.
already established. And then
Right.
Dr. Deaver served here for 40 years, so you know it was awesome, awesome person to have as well.
Yep. Okay, so this recipe, to make it a little fancy,
Okay.
we don't want that, uses red onions. And so the other thing, we've cut the onion up in about the same size as what our apples are. You
Okay,
wanna
yes,
go with
apple
this?
slices.
So you just kind of slosh them around. So sometimes on electric skillets, when you put new stuff in, it drops the temperature.
Oh.
So it's kind of the same way for, you know, on your stove. So kind of watch it, because this is supposed to be, you know, fast, like 20 minutes and you're done.
Okay.
So you kind of want to just sort of smush them around. You don't want them real soft, but
Okay.
you want a little bite.
Right,
to it.
right, for sure.
All right. And then the next thing we'll put in is the apples.
Apples, okay.
Okay.
How many was this whole thing? I kind of put about 2 cups, I think.
Yeah, it's about 2 apples.
That looks about good, right?
Yeah, that looks good. So I kind of always think the same amount of apples as you have to onions.
Okay. Yeah, good,
Um,
nice ratio.
Yeah. So in fact, we could use a few more apples. I see you went to Walmart and
I
you
did.
had Walmart slice these up for you.
Yes, yeah. It was, I went to them specifically and asked them, hey, look, Dr. Harr, she's doing a cooking show. I need like 5 apples cut up, you know, and thinly sliced.
They did a good job.
Yeah, they did.
Yeah.
No, you know, Chicken Shave, man, we have everything. I actually stopped in 2 places. I went to Williams, which used to be Spencer's, then I went to Walmart. You know, you can find anything. We have fresh thyme. Is it thyme? How do you say that? Thyme,
Thyme.
right?
Thyme.
Right. So we have fresh thyme. So I mean, yeah, we can find everything that we needed right here for this nice healthy meal.
Yeah. Speaking of fresh thyme, we want to put some in here.
All right.
And I kind of pulled off a couple.
You already
of
pulled off a
branches.
couple? Good.
Yeah. Now.
How many?
3 or 4.
3 or 4.
Yeah.
Let's see if I can get one more. Okay.
Yeah.
And now, how do you do this? You just
Dump it
throw them
in
in?
there. Now, if you want to be real
It's fancy.
fancy,
Yeah,
you
right?
could-
It's already fancy.
we could strip the leaves off,
Oh, okay.
so that looks real fancy.
Just kind of have them everywhere.
Yeah.
So now, what all does a general surgeon do? Just what's your scope of practice?
My main scope of practice is GI things.
Okay.
So like
Gastro.
gallbladder
Okay.
disease, gastritis,
Okay.
reflux disease,
Reflux.
colon cancer
Oh.
screens,
Okay.
colonoscopy.
Extremely important. I mean,
Most general surgeons always do a little more than that.
Okay.
Because our training is to be very diverse. You know, we don't want to specialize. We want to just be able to do the general things.
for sure.
And so, you know, I can do breast cancer surgery. I can do any kind of skin surgery.
Yeah, you
skin
can-
grafts.
right, okay.
Skin flaps. So there's a big variety of things.
And those are procedures you can actually do here at Southern Plains Medical Center in Chickasha, and then you also do surgeries over in Anadarko, and then right next door at Grady as well. So
Right.
very cool.
Yep. I go both places. So for a lot of the skin surgery things, if they're small enough, I can do those in the office.
Just right here.
So, yeah,
That's so neat.
yeah. Okay, well, Our skillet's getting overloaded with food.
It smells delicious. These apples, I guess, with the onions, that mix is really nice.
Yeah.
But colon cancer, like we said, leading cause of death, one of the leading cause of death in men. Why is it so vital to hit those age marks and come in and get that screening?
Well, we have looked at different ways to screen for colorectal cancer.
Okay.
And so out of all the cancers I deal with, if I can find colorectal cancer early,
Okay.
a lot of times you have a 95% cure rate.
Wow, 95.
And
That's
I don't have anything else I can tell people that.
You're gonna have to help me with this measurement.
Actually, I would just pour it in and
You're
I'll
just gonna
tell you
pour it
when
in?
to stop.
Okay, cool. I like that. That's even better.
That's even better.
Ooh, instantly that smells good.
Yeah, a little bit more.
Okay.
Yeah, that's good right there. Okay. So we're gonna let this kind of
Okay.
meld all together.
Okay.
Oh, and the recipe says to use frozen or fresh cranberries.
Right.
So if you have them, you can do that.
I
But-
failed on that,
but-
so
well,
I couldn't find them.
It's not the season.
I know.
Yeah. So Hal got us a whole bunch of cranberries,
Yes, dried
And,
cranberries.
which I think will work just as well. And we want a cup.
I think that's about a cup. I think.
That's a huge cup.
It's a big, I like cranberries. They're super good.
All right, we'll put them in.
The ones you don't want, here, I'll put a little bit because I'll start eating them.
Okay.
I'm getting hungry. It's like 4. Tell me when. This is gonna look beautiful, by the way. I'm gonna have to get a picture of this before you put that one. That looks good? Okay, good. It leaves me something to snack on.
Yeah, definitely.
Or you don't have to use them. So just because they say that.
Right, it's just an extra flavor, just another deal at the dish, but
We're gonna just pound it.
Okay, I think we got enough liquid. We got
Okay.
it nice and soft. So Hal,
yes.
this is the only
We're gonna add the chicken.
semi-tricky. Nope, not yet.
Okay.
We're going to
Oh, flour.
put about a tablespoon of flour.
So you think another three of these little
I
teaspoons?
think one heaping giant teaspoon.
Like this?
Yeah, I think
This
that
guy?
would be close
And
enough.
then where you've kind of cleared it?
Sprinkle it. Yep.
Kind of fell out, but there
Yeah.
you go.
So basically, we're making gravy.
Yes. It's never a bad answer.
Yeah.
You know, I mean, this whole meal, maybe $15. I mean, it was very. Now, if we, you know, I had to buy a few things that you would have
Yeah.
normally had around the house, like the canola oil, but relatively, you could get away with about $15 and
Yeah.
feed 4. So pretty cool.
Yeah. Well, I think this would feed more than 4.
For sure. Look at that. Yeah, no kidding.
So, and that's kind of the beauty of these sorts of dishes,
Okay.
is that, you know, onions and apples are cheap.
Yes.
And so, you know, we don't have to have as much meat as we think we do. That does look really pretty.
It looks really pretty. Really pretty. Yes, for sure.
Get kind of scared about it because they say, you know, you have.
Okay, all right, we're done.
All right, man. Well, this looks absolutely delicious. I'm super excited to try this, Dr. Harr. Thank you so much for coming down.
Okay, you're welcome.
All right, so we've got to come up with a name for this. What are we going to call this dish? Let's call it
Chicken and apples.
the low salt Dr. Harr special chicken and apples. I'm super excited. It's got cranberries, onions. In fact, we're going to post video. Dr. Harr, thank you so much for being on Prescriptions for Healthy Food.
You're so welcome.
Absolutely. Well, we're going to continue doing these, so make sure you keep coming by our Facebook page or over on our YouTube channel. If you need anything or have any of the symptoms related to COVID, or even if you don't have any of the symptoms, we've actually just completed the build of our PCR laboratory, and we are doing testing in-house as well as telemedicine. Check out our Facebook page and our website, www.spmcmed.com, or give us a call, 405-224-8111. Southern Plains Medical Group, your hometown medical team in Oklahoma since 1915.